Dr. Bandile Masuku, he of course is the MEC of Health in Gauteng. MEC, unfortunately that sound was just so bad earlier and you were telling us such important things. So I think everything is fine. We've got you back. So I quickly want to just start off again with what you were talking about. With your speech, you said since assuming office in May 2019, you spent a considerable amount of time putting together the strategy and plans for the next 5 years. You were going through them with us, but perhaps you can start by picking up the conversation there in the briefest possible way you can.
Yes, no, I think the most important thing, and sorry about that, we are suffering from load shedding like all of us. So my gadgets are very low. So the whole point here is that we've got 6 priorities. We call them 5+1 because the +1 relates to the economic growth and our contribution as a Department of Health to the economy and job creation using our budget spend. But the whole 5 that we are having are the ones that deals with patient experience as the first priority, being one, and the second one is the one on improving clinical outcomes with a major focus on mental health and HIV and AIDS. The third one being strengthening our capacity on our leadership and management. The fourth one being public health education, which all of these priorities, when you look at them, they actually tie in very well with what we are currently doing with the COVID response. That the last one just preparing for the national health insurance. So these are our priorities, and we have proposed our APP to make sure that even if we are developing a COVID response, we are still continuing with implementing our strategic plan going forward.
You know, we talked to the health facilities in Gauteng, and unfortunately, it's been dire over the last couple of years. We've seen them degenerating over a period of time, just on basic maintenance and upkeep and general health standards. And that's even before you talk about overburdening, and especially now with COVID-19. R1 billion is what's been set aside for the refurbishment. How will you ensure compliance with the national core standards that you speak about?
Yeah, remember from the last conversation we had, Leanne, that we had already been in the process with the 10 hospitals. But what we then did was also to tie in all our CHCs, our community health care centers, which refer to the hospitals, so that when we do the general refurbishment and re-strategizing and reprioritizing all the programs in that, we also include our CHCs, because we need to strengthen our primary health care. We also need to strengthen our individual hospitals so that they become a seamless system. So that's what we've been doing, and the whole implementation was just interrupted for the first few months of the lockdown, but everything now is underway. We are going to be doing the whole work in all our facilities, particularly the 10 priority ones.
I mean, the province is home to 4 of South Africa's biggest Gauteng academic hospitals. We've got Chris Hani Baragwanath Academic Hospital, Charlotte Maxeke Johannesburg Academic, Steve Biko, Dr. George Mukari Academic Hospital. I mean, these facilities are responsible for training doctors, specialist nurses, as well as conducting research. But, you know, these institutions in the past were held in high regard, but the state of depreciation and stories that come out of these facilities are disheartening. How are you hoping to bring these hospitals back to life, so to say?
Yeah, I think there are also positive stories, the end that comes from our facilities. You would remember that for the first time last year, we did bring back transplant surgery into the private, to the public sector, which is some of the few stories that are coming back. And it's something that we are hoping that with all what we are putting in, is to make sure that we bring back, the previous story. But there is positive things that are happening in these actual facilities, and they still remain the national asset. Hence, we are working with the national department to improve their funding and to improve their governance within that. By design, the central hospitals or the academic hospitals, as they were, they are actually a national, actual assets, which mainly the budget and funding should be actually from, the national government.
You mentioned that NHI is still on track. You know, this state of devaluation raises a big concern about whether NHI will not actually make things worse, given the factors you also cited about the overburdening of these facilities due to migration. How will this be managed?
You know, it's going to be a broader discussion, because firstly, we also need to work out how the health system would be. Because at the current way that the healthcare system is, it's curative, it's hospice-centric, and that on its own, it's very costly to run. So we need to re-engineer, which I think the COVID pandemic has helped us to re-engineer and strengthen the primary healthcare, and also talk about prevention so that we lessen the burden, in hospitals. Then it will make it easier for us to have necessary budgets to be able to run it. Because even if we do have NHI, with the way the system is, it will still be expensive, and it will still be costly actually to run. So it's a broader discussion, a systemic discussion that we need to have to just re-engineer the healthcare system and deal with prevention more than the curative talk. And then it will be, at least over a period of time, it will be much less costly to run.
Let me see, we've got to leave it there. I wish I had more time with you, but thank you for giving us a glimpse into this budget and also the future for the health sector here in Gauteng. That was the MEC of Health, Bandile Masuku, talking to us here on the program. That's it from me. Sakina, we've got to say goodbye. See you tomorrow.
Indeed we do. That's day one down of the week here on Morning Live, and we'll